This PowerPoint was prepared by Texas Tech University Health Sciences Center for training educators in helping schools to become safer environments for learning. The slide in this presentation will focus on these objectives. Educators spend a significant time with children, sometimes even more waking hours than their parents do, and intervention can prevent the loss of academic development. Educational intervention can be crucial, especially when there's a lack of resources, and progress monitoring can be conducted more easily in an educational setting. Educators' intervention can mean the difference between life and death. We're going to look at some definitions now. Sometimes there is a disconnect between what clinicians define as mental health and what educators see as demonstrating mental health. But the reality of the school is that there are many pressures on students. Educators are not trained in all of the many signs of problems this can cause in students and how to handle these. Looking at these statistics, visualize a classroom with 20 students. 5 will possibly be affected by mental health disorders, and one of these may actually receive the help they need. Of the behaviors being observed in the classroom, which can the student control and which may be the result of a mental health disorder? Consider how you, as an educator, can help keep students staying on the right track and out of an alternative education setting. Many students who are referred to alternative education settings do not reintegrate well into the regular education setting easily. Solutions are to help educators identify symptoms and implement strategies that would reduce or eliminate problematic behavior. This was the thought behind Senate Bill 460, which requires this training. This section begins a portion of the training in which each disorder is outlined individually by behavior symptoms, and effective classroom interventions are provided. ADHD is commonly seen in academic settings due to the required attention. Problems with attention are consistent and most commonly seen by age 12. Best options for treatment for children is medication. If left untreated, these symptoms can evolve into oppositional defiant disorder or conduct disorder. Revoke zone. The last intervention listed here is this. It is involving a secluded area in or outside the classroom in which the student can regain control of his or her behavior. The use of a refocus zone is discussed with the student prior to implementation. It is agreed that the student will voluntarily go to the zone, set a timer, usually you start with about 3 minutes, and work to regain composure in that amount of time. The idea is to extinguish the student's need for a refocus zone by decreasing the number of minutes over a period of time and to provide the student with an opportunity to learn how to manage his or her own behavior and responses independently. Negotiate with the student ahead of time. Be sure that they understand that this is a way of working with the teacher that works for everybody in the classroom. A code word or signal can be used to indicate a need for the refocus zone and can be utilized by both the teacher and the student. It should be set up during the negotiation phase. Positive reinforcement is critical in the beginning of the technique before behavior control is learned. Secondary positive behavior reinforcement could be a free computer time or something like that. In elementary, positive behavior reinforcement can be tangible like a token economy system. A crucial component to the success of the refocus zone is encouraging the students' faith in their ability to change. This is not timeout or punishment. Oppositional defiant disorder is a common disorder. Avoiding power struggles means giving options for students that arrive at the desired behavior. For an example, you may complete the assignment during class or you may come in after school. Let me know what you decide. Building a rapport can be accomplished by taking interest in something that is important to the student, in or outside of the classroom. Conduct disorder. At this point, problematic behavior usually begins to have legal consequences. If intervention is not sought for oppositional defiant disorder, conduct disorder is the most common progression. De-escalation includes lowering the volume of your voice, maintaining appropriate personal space, open posture, no arms crossed, open stance, carrying nonverbal cues, concerned look on your face rather than mad, relaxed posture. Because of the inability to see potential consequences, a student's behavior may become violent. If these students are not taught management techniques as they get older, they may also exhibit behaviors characteristic of personality disorders. Unusual nonverbal communication may be demonstrated as hugging, excessive touching, or avoidance of proximity. Sometimes both ranges will be seen at different times in students with this reactive attachment disorder. You may want to set up practice academies. That means modeling appropriate behavior in managing the behavior. Practice academies are role play where teachers model the behavior they are trying to change and the student practices or models the desired behavior. Disruptive mood dysregulation disorder. A student with DMDD will appear to be angry at all times. Reactions are not age appropriate or proportionate to the situation. Cannot be diagnosed if the student meets criteria for another disorder such as ODD, bipolar, or something like that. Structure with minimal amount of change, and change should be explained ahead of time, will help these students. We are seeing an increase in the number of students with anxiety due to testing pressures and staff members' reaction to pressures. These students may ask questions about future events prior to the expected time. For example, at the beginning of the class, are we going to have a test today? This can easily lead to substance abuse, this anxiety disorder. Preparing students with anxiety for upcoming events, assignments, etc. can be helpful. In severe cases, providing an isolated location for a student to complete assignments may also be helpful. More and more schools are experiencing tragedy. PTSD is a common response. Younger students may act out the experience in play. Older students may begin abusing substances to self-medicate. Students with PTSD are often overwhelmed by everyday interactions. Allowing students to leave the room to regain control and reduce stimuli can be a very successful option. This would be another use of a refocus zone. Students may need a non-judgmental person to allow them to express themselves in their situation. People working with students with PTSD will want to be cautious about physical touch as a reassurance or bonding technique. Depression. Approximately 11% of adolescents have developed a depressive disorder by age 18. These students may be seen as lacking motivation in the school environment. They may appear sleepy due to changes in sleep patterns. They may also appear to lose or gain weight due to changes in eating patterns. It's very important to recognize symptoms prior to suicidal thoughts. Depression in children and adolescents is treatable and responds well to medication intervention. Students with depression need encouragement and positive reinforcement. Flexibility of academic and personal deadlines can be an important additional resource in the treatment of depression. Bipolar disorder. One side of bipolar disorder looks like the symptoms of depression we just discussed, but you will see markedly different mood when the manic phase is active. They may seem as though they have an on-off switch, and when they are manic, the switch is on. Changes in school scheduling can have a profound impact on academic success if a student has a daily mood swing pattern. Concentration and focus can be difficult to maintain during mood fluctuations. Breaking assignments down into small segments and/or using the refocus zone can be an effective intervention. Most of the classroom interventions can be used interchangeably throughout these slides, but consistent classroom intervention can be used with all students, and that is a best practice for competent teaching. Posting a daily schedule is an example of a simple thing that can be done to help all students without calling attention to the ones that need it the most. Teacher flexibility and a refocus zone work for most kids. Psychotic episodes involve more than just one of the first three symptoms that are listed here. They may be associated with disorders other than schizophrenia. It is important to get the student to a safe place and also create a safe place for other students. Suicide has become the elephant in the room. It used to be taboo, but is becoming increasingly more frequent. Suicide is the third highest cause of death in adolescents. It is an avoidable death. This protocol for crisis intervention is a sample provided by the trainers. Though Hawkins does not have the forms with these titles, the process is quite similar to our own. The most important thing is, if you realize a student is in this kind of trouble, get them to a counselor or administrator right away and don't leave them alone. The assessment process is designed for an appointed person on the campus, the counselor, administrator, or nurse, to be the primary contact in the event of mental health emergency. Suicide assessment is a different methodology. Three-week reporting procedures can be a crucial factor in gathering the current data on a student that needs some intervention procedures. Official and unofficial documentation processes can be done by using existing processes and templates found in ADA Section 504 Student Support Team format. The response to intervention documentation process for Tier 1, 2, and 3 can be included as documentation for referral of services as well, a measure of intervention that has already been done. These documentation resources should be copied and taken to appointments with referral sources. A student support team meeting should include parents, educators, and administrators. This letter is an option that can be provided during the student support team meeting and is from the parent guardian to the physician with accompanying records from the school. The following are frequently seen in an educational setting as well. There are varying degrees on the spectrum from mild to severe. Educators may be more familiar with the communication challenges and behavioral patterns, but it may be easy to overlook external stimuli that may cause the student's behavior to escalate. Important to provide support for these students. Understand they may need to be directly taught social skills and cues. It is important to recognize the anxiety caused by body image issues. These students may also seem to do things perfectly: diet, exercise, external beauty, grades, extracurricular activities, etc. The best thing an educator can encourage is progress, not perfection. This disorder is characterized by repetitive behaviors. These symptoms can easily lead to distraction from and failure to complete a task. The student may appear noticeably anxious about the behaviors. Redirecting a student's repetitive behavior can be helpful if it does not cause more anxiety. If behavior is out of control, then accommodations can be made as suggested in the slide. Medication can be an important component in OCD treatment and should be determined by a physician. Fetal alcohol syndrome. A student with this disorder may be taking things off of others' desks and have no respect for privacy and personal space. Some students will fall into the wrong crowd as a result of being a good follower. A student's diagnosis of FASD may not seem to learn from his or her mistakes. Modeling appropriate behaviors and immediate consequences for actions is an effective technique for students with FASD. Adult role models can make a positive difference in all students in their sphere of influence, especially students with FASD symptoms. They may forget what you said, but they will never forget how you made them feel. Let's remember that. There are some places for some additional resources. At the close of this movie, you will need to complete a quiz that you will find right under this information. Thank you for listening.